It's for everybody, and we don't discriminate anyone. Everyone, doesn't matter what village you come from, what religion you are believing in, politics, doesn't matter. Everybody comes, and that's, I think, important too, because they see this is a place that they can go and be helped and taken care of. The clinic has been able to help people who have illnesses that they can't treat at home, like need some medicine, Western medicine. We have natural remedies, but they can use it for so many things. But if you have let's say a poison snake bite, you're gonna die in a very short period of time. Even with natural remedies, you can't really treat it these days. So the clinic also has other medicines for children with respiratory infections, or maybe the vaccines are so important. Kids who have viral infections, or adults, women, now that we have young women, that they can have babies at home, that's normal, but the government also wants to make sure they get a birth certificate, they get an ID. When they go to the clinic, they're able to have that documentation. So it creates a healthier community as well. We can teach them and educate them, for example, in oral hygiene when we have clinics. 12 years ago, teenagers already didn't have front teeth. And now with the clinics, the oral hygiene education, we're able to see these kids, students at school with front teeth, I mean full sets, teeth, and adults also having a better care. I think teeth, oral hygiene is very important for health. That's sometimes how you start getting other problems. So it's very important. We have added several communities, the service. Now we see in adults mostly with hypertension, they have diabetes, cholesterol. Before we didn't know these things. Terminal illnesses sometimes, or TB, they're able to get, we have a lab, they're able to get results in a fastly manner. Like before, they had to go to the city. They have very, very low income. I mean, the income is not permanent either. It's like maybe what somebody in the city can make in a month, they make in a year if they farm or fish enough. So it's kind of complicated if you tell a patient that is really sick, okay, you got to come and I'll just give you some painkillers. But then the other problems are there. They're never going to get well. Diseases, as most maybe people, when they are thinking about the Amazon, you'll have malaria, you'll have yellow fever, or you'll have dengue. No, they're not a problem. They're not a problem. There's all kinds of different issues, just like in the city. But we don't have diseases that are high rate mortality here. Like babies are born, we have a very low rate mortality for them. They are born healthy. In most cases, if they see anybody's going to have complications, they know ahead of time and they send them to the city. If they don't come and they have the baby at home, we want to make sure that they get vaccinated so the clinic comes healthy, or our medical staff goes doing vaccines in communities every season. Donors are the reason we exist. Without donors, without tourism, we wouldn't be able to do what we do. And it's so important because the clinic supports now 17 communities. We started with 7. We have 17 communities. People that transportation is difficult to get here, as you know, this in the low water. They don't have ways to get to the city if they have an emergency, for example. The emergency, the closest is the clinic, and the only one that is fully equipped. Now it's a Hospital 11 by the government because of the facility itself. As pharmacy has, the pharmacy, I get more medicine with donations in order to have medicine for patients. Patients come in with nothing. You can't refuse treating them. The lab was due to donations to get equipment. Bathrooms are so important because when we have patients, we didn't used to have, and then it's just like at home, many of them don't have. When they get sick, they have to go in the woods or at home. So important, very important. Water is so important for us to keep everything clean. Children that come sometimes and stay, if we didn't have a place like that to to take care of the kids, overnight patients, we would be able, we wouldn't be able to do the job. And no matter how good we pay a professional, but without tools, they can't help you. So yeah, donors are very important. They make everything possible. We stretch money here because we don't get paid. We're volunteers. What we do, the volunteer work, is because we have passion. The passion is what drives us to do things. And when you see a child smiling and telling you, like, okay, coming out of the hospital, are you in pain? You see them coming crying, and then when they leave, they're smiling, or they seem to be walking. It kind of just, all of a sudden, all the expenses and everything that you went through, it just erases, and you just think about that smile. Or when a kid for our education program comes in to school, you visit, he can't read or write. No one in the family is doing that. So we decide, okay, we're gonna help. And then you go the next time, or talk to the parent and see the kid and say, bring a book, and then they start reading to you. It's just like you took a veil off the eyes of this kid that can see and discover so many things. Planting the seed of learning is very important. So we want to start young, and that's why we help the schools. And also educating, not just in things to get a career or writing and reading, but also about our own environment. Every place, as you notice in the cities, big cities, are so contaminated, so damaged. And here we want the kids to learn also to appreciate what we have and see how we can help them to understand better and try to take care of their own environment, because this is where they're growing up.